This is Work University, episode 24.
This is Work University, and I'm Annalisa Felix. This is where I talk to people from various employment backgrounds and get a better idea of what their job is really like. If you're just graduating or looking to change careers, you're in the right place. Now let's get to it. Hello, today I'm welcoming Dr. Christina Tran. Christina, welcome to Work University.
Thank you for having me.
Tell us, what do you do?
Okay, so I am a veterinarian.
Mm-hmm.
I have spent most of my almost 20 years as a veterinarian in some form of what's called small animal work, so primarily working with cats and dogs.
So 20 years, wow. That's a lot. I mean, I would just assume that sick animals come in. What happens at your office that maybe we don't know about?
Okay, so I currently am actually owner of a house call practice. So I go and work on cats and dogs, but I go to the owner's home to do that, which is a fairly new area that more veterinarians are exploring as far as a career option. But most of what I do, whether it's in a traditional hospital or if I go out on a house call, is the owner talks to me about what's going on with their pets. Either they're there for vaccines and a checkup, or maybe the pet is feeling ill and we're not sure exactly what's going on. So I do some talking to the owner, do a complete physical exam, and then I make my recommendations as far as whether or not we need to do any testing or prescribe any medication, or if surgery is necessary, we discuss that as well. And I spend a lot of time talking to owners.
So if you're mobile, and it sounds like there's a lot more mobile action happening these days, then if they need additional treatment, do you suggest that they come into the office, or do you have a lot of that stuff with you?
So I have limits as to what I have. I don't have a mobile unit as far as having the ability to do x-rays or anesthesia or surgery, but I work with local hospitals that I can refer owners to if those services are necessary. But I do try to care for as many animals and their illnesses as I can. But when I reach my limits as to what I can do, I then refer them to other hospitals that have capabilities beyond what I can do.
Now, looking back to the days when you were in a facility, on the day-to-day, what did your day look like in addition to actually seeing animals? Because is there administrative? You have HR, hiring, things like that. What other things did you have to look at that maybe somebody wanting to be a veterinarian may not even think about? Okay,
so I would say that I think the typical idea of what people think a veterinarian does if they're working on cats and dogs is that in a typical day, and it's hard to say what a typical day looks like, but you're spending a certain amount of time seeing appointments. You're spending a certain amount of time potentially doing surgeries and dentals, teeth cleanings, that kind of thing. You spend a certain amount of time talking to owners, whether it's in appointments or on the phone. And in this day and age, sometimes we're texting with owners or emailing them back and forth. You're also having communications with other doctors, either at your own hospital, or if you're referring clients to other practices, then you're talking to those veterinarians, trying to get them up to speed on why you're sending a case to them, and then also getting information back once that pet is seen by them. They oftentimes will come back to you for continued care, and so you communicate with those veterinarians to find out what needs to be done in the follow-up. And depending on what your other responsibilities are, you may have some involvement with HR as far as helping with the interview process. If there are new veterinarians that you're looking to hire, or veterinary technicians or nurses or other staff, then you may be involved in the interview process with that as well. And depending on the practice, some places will do a certain amount of community outreach, so they may have talks that they give to their clients or potential pet owners, and so there's a certain amount of outreach that happens as well.
So within the last, I'm going to say 20 years, I'm sure a lot of things have changed as far as technologies and things you have to learn. Are there other certifications that you have to keep current?
No, so essentially the traditional pathway for becoming a veterinarian in the United States has been the majority of veterinary schools will want you to have completed an undergraduate degree, or at the very least complete the coursework, the prerequisites that you need to get to apply to vet schools. And every vet school has different requirements as far as what courses they're looking at. And so there are some instances where you can potentially apply to a veterinary school without having your undergrad degree, but you would have taken a large number of science and math courses to complete their application process. And then veterinary school itself is 4 years in the United States. You pass a national board exam during your 4th year, and depending on what state you plan to practice in, there may be a state exam as well. And then you are licensed to practice as a veterinarian, and there are continuing education requirements that you may need to fulfill depending on what state you're licensed in. Mm-hmm. But beyond that, there isn't any requirement for additional licensing that you have to keep up. But some people, just like in human medicine, they will go on to do internships and residencies so that they can then specialize in different areas of veterinary medicine.
When you say undergrad degree, it could be any bachelor's anywhere, but you have to go to a separate veterinarian school after that, or do any state schools have that?
So undergraduate degrees, yes, I would say you could be any major in undergrad and apply to veterinary school. The tricky part is there are a large number of math and science courses that are required to apply to veterinary school. So what ends up happening, most students that apply will have some kind of a science major. So, for instance, I was a biology major in undergrad, which is a fairly common one. There you see a lot of animal science majors. Every now and then you'll get somebody from liberal arts, maybe a history background or an arts background, but not as often, just because essentially they'd be taking all the classes they need for their English degree, but then they would also have to take a lot of math and science courses that I would assume would not be part of their English degree. So then they end up taking a lot more classes. But for some people, that they want that ability to do something outside of science and math that they're really passionate about. And I often think it makes for a very well-rounded and diverse student population when you go to veterinary school. If not everybody is a science major, then you have people that offer you some different backgrounds and perspectives.
Do vet offices have the capability for people to bring in pets that they can't take care of?
I mean, it is a business. They have overhead, they have staff, they have salaries to pay. And while all people that work in veterinary hospitals truly love and are compassionate about animals and their care, we have financial limits as to what we can do if there's not an owner who can pay the bill. And so what I would say to those that have a pet that can no longer care for that pet for whatever reason, reach out to local rescue groups to see if they are able to hand over an animal to them. You can also call different shelters and see if that's an option as well. You can ask family and friends if they can care for the animal and take on the financial responsibility of owning a pet. But yes, I mean, unfortunately, people do it quite often that they will decide that they can't care for animals and then leave them in a box in front of a doorstep of a veterinary hospital. But, just like a business, I mean, there's many businesses like that. They don't have a fund that allows them to just care for animals that are abandoned, essentially.
Sure.
So those would be the options I would consider if I was talking to somebody who was concerned about relinquishing a pet.
Now, going back to your duties or, your day-to-day, did you have to perform surgery?
Yes. I did a lot of the routine surgeries, so spays and neuters, lump removals. I would do teeth extractions, teeth cleanings. Sometimes it would get interesting and I would do surgery to remove stones from bladders, or if there were foreign bodies that animals had eaten, I would go in and remove those from the stomach or the intestines.
Oh, I bet you saw a lot of that.
I saw a fair amount, yes. I did not do orthopedics, though, because for me, with the level of additional education I would need and the infrequency that I would be doing it, it didn't make sense for me. And I didn't feel, as strongly about learning the orthopedics because I knew there were enough specialists who would do it that I could refer patients to those individuals. But yes, I loved soft tissue surgery.
Now, for your education, or even just coming through because you have a long time of experience, 20 plus years, and so I'm thinking almost 30 years total, with education also. Were there any obstacles that you had to overcome or anything that you saw that, changes you kind of had to pivot and maybe move a certain way that kind of comes to mind in becoming a veterinarian?
I think the most common thing and something that I definitely experienced is that, it's a competitive process. And even if you submit an application and you meet all the minimum criteria, that does not guarantee that you will be admitted into any veterinary school because there are so many people that are competing. And I experienced that when I had applied after undergrad is I did not get in on my first application. And so I had to make a decision as to whether or not I was going to take another year to reapply, improve my application, or if I was going to change careers altogether. And I think that's a very common thing that happens to a lot of pre-veterinary students is the what if. What if I don't get in? What do I do? And it oftentimes comes up in the interview process because at that point they are not guaranteed a spot and they are still in the application process. And that's oftentimes a question that comes up in interview is what will you do if you don't get in this time? And the answers vary quite a bit. But I think that's one of the big challenges is to say to yourself, kind of evaluate and say, is this really what I want? And am I willing to do whatever it takes to get into veterinary school and become a veterinarian? And fortunately, I did get in on my second application, which at the time, I think for every seat that was available in an entering class, there were probably about 7 or 8 applicants. So as you can imagine, it was pretty competitive then. I think the numbers are different nowadays. I don't know exactly what they are, but we've increased the number of students that most veterinary schools will take in an entering class. And there are a couple more schools that have opened since, the late 90s, which is when I went through veterinary school. So there's more seats available. And because of that, I think that what used to be the 1 in 7 or 8 is probably less than that. It's probably, I would guess, maybe 1 in 3 or 4 as far as seats available in an entering class per applicant.
So do most vet hospitals offer shadowing opportunities and internships for students to not only when they're in school, but maybe even before, so to make sure that this is what they want to do?
I would say that's not very, it seems to be less and less common that people will allow pre-veterinary students, whether they're high school age or college age, and even less so if they're younger, if they're middle school or junior high, in to either volunteer their time or observe. I think a big part of that is liability. There's a lot of concern, obviously, in a veterinary setting that you can get injured. And so I think that is part of the reason why you see less and less opportunities for young people to come in and learn what it's like to be a veterinarian before they commit to the process. But one thing I would say is, don't be discouraged by that. I think that there are people that are still willing to do that. But I think part of it is building trust and knowing that they're committing to somebody who is fully committed to following through on volunteering or observing. And, I think having conversations with the practice manager or with the veterinarian and explaining why this is your passion. And even I often think that in veterinary medicine, you can actually learn a lot about the career by doing things like this, listening to a podcast, talking to people that work in a veterinary hospital to find out what it's really like. What are the challenges? What do you love about your job? What surprised you about the position that you're in? And because I think a lot of people are quick to want to be in a hospital setting, but oftentimes, it's not as exciting as you think it's going to be. There's a lot, especially in a small animal hospital, there's a lot of very routine things that are done, every hour and several times an hour, like drawing up vaccines and, doing physical exams and doing blood testing, urine testing, prescribing medications. And, it's also not all about petting puppies and kittens either. And so I think there is some value in seeing what happens in a veterinary hospital. There are times when owners can't afford to care for their animals. There are times when animals have a terminal illness and euthanasia is being considered, or euthanasia is going to be performed. And sometimes there are emergencies. And so how do you handle emergencies when they walk through the door? And, so I think there is value in observing, but I also think that along with that is the idea that it has to be active observation, maybe not in that moment because it may be an emergency and they can't take time to talk to you, but I encourage people to have conversations with those in the veterinary field, veterinarians, veterinary technicians, to find out what they love about it and what challenges they have, because you can learn a lot about the career path by just having those very easy conversations with people.
That's a lot of good information. You covered about a few questions that I had for you. Thank you. I can assume that, you love animals. What are some of the things that maybe are not desirable about this position that maybe you want to shed some light on, to say, hey, you know what, there are a couple of things here that, you have to get used to, and so forth?
Okay. So there's several things that I don't know that people are fully aware of. They've come to light recently, but one of the big things that comes up in conversation sometimes is euthanasia and how frequently it actually happens in a veterinary hospital. And a lot of people have not seen a euthanasia done. And I can tell you, as a veterinarian, it is something that I do probably several times a week, if not several times a day. And, to be able to be compassionate in that setting and to be able to be there for the owner, to be there for the pet, it can be very emotionally exhausting. And then to turn around and your next appointment is a small puppy and, a young family, and they're very excited about this new animal. So there's a lot of emotional ups and downs that happen in a veterinary hospital. And so that's one of the things that I wouldn't say is a turnoff, but is very challenging on a regular basis. You can feel a certain amount of compassion fatigue in veterinary medicine. And then another thing that it has become more and more open to the general public is the amount of the stress on the mental well-being of veterinarians and those that work in the profession. There's a large rate of suicide that happens within veterinary medicine, and I think there's a lot of it's a very high rate. I don't know the exact percentage, but and I think part of that is there's a lot of stress put on veterinarians to be perfect all the time, whether it's stress that they put on themselves or the expectation of owners to do whatever they can to save their animals, and oftentimes to do it without being paid much. There's a lot of financial stress on the younger veterinarians, probably the ones that have been out 15 years or less. The average debt load is somewhere around $250,000 for veterinary school alone. So there's a lot of stress for them to pay back loans. They don't make a lot as young veterinarians. And then, the other part that I think plays a role in this is social media, unfortunately, and the fact that people are more than happy to sometimes go online and say negative things about a veterinary practice or specifically a veterinarian. And veterinarians in general are people pleasers, and they want to help people, but we all have limits. And to see that can be very hard for anybody, but especially veterinarians. And the other thing that you have to consider is that veterinarians also have access to medications and drugs. Amongst those are euthanasia drugs. And so that's sometimes the route that they take. And I know it's kind of going to the dark side a little bit, but suicide rates among veterinarians, particularly veterinary women, is much higher than the general public.
Dr. Christina Tran, thank you so much for your time and giving me a glimpse of what you had to go through and what's happening in the veterinarian field. I appreciate it. Thank you so much.
Oh, you're very welcome. Thank you.
Thank you for listening. I hope you liked this episode. If you have a particular job you'd like me to look into, send me an email at workuniversityforyou@gmail.com. That's workuniversity, the number 4, the letter U, @gmail.com. Thanks, and I'll see you next time.